it's a really important day for us because it signals not just the year that's actually gone by, but it actually is about the year that we're actually into now and the future for the organisation. And so it really is a pleasure to actually welcome everybody here. And what I want to do is actually just go through a couple of the major events in terms of the last 12 months. It has, by any stage of the imagination, been a challenging year for this organisation. It has been a difficult year. It's resolved in a whole series of different events. The Welsh Audit Office and Health Inspectorate Wales report were reports that this organisation did not want to have received, but then having received them, they had to act on them, and act on them they did, and very quickly. There was a Public Accounts Committee meeting in December 2013 with a follow-up, in fact, in my first month, which Dr. Hickson and I and a couple of other colleagues around the table attended. That report obviously highlighted significant concerns in the governance and some of the assurance processes within the Health Board. I think standing here now, I can't tell you that those have all been resolved. What I can tell you is that we've made significant improvement and progress around many of those areas, which was highlighted when we went back to the Public Accounts Committee, in fact in July, what's July? These months go by so quickly, Peter. So the journey has started in terms of rebuilding trust and confidence, and I particularly wanted to thank the team who've actually been doing that before I was able to join in June, and to thank Peter, who obviously came in October, who inherited much of the issues that then had to be resolved. And a particular thanks to Jeff Lang, who stood in for a long time as the interim chief exec and has actually been instrumental in a lot of the improvements that we're now seeing. We are, as I highlighted though, moving into one of change and renewal. There has already been significant changes within the leadership team for this organisation, not least Peter and Margaret Hampton as the new vice chair, and there have been other appointees around the table. We have a new medical director, we have a new nurse director, we have a new finance director who's joined us for his first board today, and I confirm that actually we've now been able to appoint a new substantive chief operations officer who I would hope will be starting towards the end of September, if not early October. So we are moving on quite rapidly in terms of the restructuring of the leadership within the organisation. Clearly, one of the areas that we're focusing in on is the last of the bullet points there, which is actually a review and a renewal of our strengthening of our partnership working. Clearly, where we are as an organisation at the moment is a need to realign ourselves with the 6 counties, working much more in harmony with our local government colleagues and also with the third sector. We are, as we speak, in the middle of a consultation with our staff at the moment on changing our organisational structure, which will reflect those 6 counties with 3 sub-regional groupings that will enable us to be much closer to our primary, our community, and to our colleagues within the 6 local authorities. That consultation is due to conclude, Martin, I think it's the end of this month? 12th September. And I would hope that we will be able to move quite rapidly then to a different organisational structure that will actually embed us much more within our communities and our localities. We intend to listen much more closely to patients, to our staff and to our partners, and to enable our front line and very much our partners to help drive the changes within our organisation as we move forward. It's not just, however, locally that I want to signal a change within our relationships and our direction. And clearly we don't work in isolation in Betsy. and we shouldn't. We are part of the NHS within Wales, and albeit we are the largest NHS organisation in Wales, in fact we're the largest NHS organisation in England and Wales, we do need to recognise that we have a role and responsibility to engage with colleagues across Wales. And we are much more focused about ensuring our networks cover the whole of Wales and link equally strongly into the NHS in the northwest of England, where strongly some of our clinical connections need to be manifestly linked with the universities and with the academies. Our core purpose is population health. People have heard me say this before. We are not just an acute organisation. We are an organisation that has to focus on recognising its roles and responsibilities in working for the long-term sustainable health gain of our population. And that means our focus as we move forward will be much clearer and much more around prevention and health promotion, putting public health at the centre of what we do, linking very clearly through a revised and re-energised community and primary care network, and recognising that primary care doesn't just mean GPs. There's a whole raft of our own professions, plus others within our community that have a major role to play as we begin to move further forward. We will provide safe, high-quality services delivered with dignity and compassion. And we will deliver those as close to home as possible. We will start to hit the point, not just the target, and we will actually do the right care in the right place at the right time, rather than where historically some organisations have seen us in the past. The annual quality statement has come today to the board, and clearly re-emphasises much of what I've just said in terms of our focus, and it will be a key driver for the board as we move forward in terms of actually where we need to focus our attention to ensure that those services are delivered in a safe and sustainable way. Infection control, that was pointed out by the original Professor Durban inquiry and review, was an issue for Betsy. It has, however, made significant progress, and we continue to strive to make that even more a focus for us as we go forward. There is a growing demand on our services that we have to recognise and react to. One of the reasons why I want to focus the organisation more around primary and community services is to ensure that we actually start to deal with some of that growing demand within those areas before there's a necessity to actually deliver care in a secondary care setting. Clearly, medical science moves on, and clearly one of the areas that we'll also be focusing on as we go forward is a greater use of day surgery and other techniques that are less invasive. We know that at any one point in time, between 30 and 40% of our acute hospital beds are filled with people that could be dealt with and cared for in other locations if they were available. But clearly our relationship with local government, with the third sector as I've said, but actually with our community and primary care services is fundamental to ensure that we deliver services in a different way over the next 3 to 5 years. We see continued growth in our pressures around unscheduled care. Again, we need to ensure that we have alternatives to A&E in terms of dealing with non-urgent, non-emergency urgent issues. Those are areas that actually we will continue to work both with Wash Ambulance Service and with our primary care colleagues and with pharmacists as we move forward in terms of providing our population with a raft of alternate ways other than attending through the front door of a hospital. We will focus significantly on prevention and well-being as we move forward. For me, it's absolutely clear that if this organisation is going to continue to grow the way it needs to grow, that the demand that we actually focus on has to be around how we deal with prevention and how we deal with issues such as long-term conditions in a much more holistic way, rather than waiting for people to attend because they've actually exacerbated a particular condition. As I said already, our aim is to deliver care as close as possible to where people will live. We continue to see significant investment in our estate, across the board, and in our community and in our hospitals. We've opened up new facilities, which are covered within the annual report, and the new emergency quarter in Bodlewydden is now opening and fully functioning, as is the continuation of the work around the asbestos removal. We will continue to see developments as we move forward, and we're planning for more developments, particularly within primary and community services over the next 3 to 5 years. There is pressure on public finance. It's not just NHS, it's local authorities, and it will continue to be an issue as we move forward. There is bluntly no more money. What we have to do is focus on our productivity, our efficiency, and recognise that actually what we need to do is spend that money in the most appropriate places possible to ensure the throughput within our system. We are continuing to miss our waiting times, and they will be a priority for this health board for the remains of this year, and certainly for the foreseeable future. We will bring our referral to treatment times back in line with the expectations of our population and of Welsh Government. And we will make it a key functioning part of our 3-year plan that will come to the board in January to ensure that is maintained and sustained over the period of that development. 3-year plan will come, as I say, in January, and will identify this health board's priorities over that period, aligned to its spending requirements, its workforce plan, and its focus on the delivery of quality and safe services. We want to hear from patients and carers and from their families, and we are piloting a I Want Great Care app now within Wrexham, which we want to roll out to the rest of our hospitals, which will give people the real-time opportunity to tell us what they think of the services that they're receiving at that point. And we will ensure that we make that as transparent as we possibly can on our website. And we would want to move to a point where that's a live feed that starts to show clearly how we want to be judged as we move forward. We will be open and transparent with our population. We will be open and transparent with our partners. And I've made that, I think, perfectly clear since I started, even with my first conversations with the CHC, is that there are difficulties ahead. We will deal with those together, and we will look to see where we need to focus our resources to ensure the greatest good for our population in North Wales. But feedback is vital if we are to improve, and feedback will be taken on board by this board in a very open and very transparent way. That last slide, looking to the future slide, really just picks up on the bits I talked about. We are looking future and planning how our services will be sustainable. It will be a focus now around delivering them through a modern primary and community-centric strategy. It will look to see how we can move our secondary care services to ones that are efficient, productive, and delivering within the timelines and the timescales that we wanted to see. The 3-year plan will continue to reinforce the shift towards a primary-centred set of delivery mechanisms. And we will be putting out a series of touchstone tests in the next few months. Touchstone tests are a way where we can try and gauge, you can try and gauge whether our services are working and improving. So when I stand up here next year, the expectation is that those touchstone tests will be very clear, as will the pledges that this health board will have made to see how it can be gauged over the next 3, 5 and 10 years in terms of the improvements within the service delivery and the way in which you are treated and the way in which your conditions are managed. Thank you.